All right, Dr. Emer, you're live now.
Alright guys, we are now on part 2 of our CO2 laser resurfacing. We already did the deep portion, which you can see in the outlines over here. But now we're doing the superficial portion. She's using our Pronox device to help any pain, and she also has nerve block. So everybody feels the CO2. They just feel it a lot less when we do this combination. She's really strong. She's doing awesome, which makes me super happy. And this portion of the laser, the active FX, is more superficial and has larger columns. So you see here, 1.2 millimeter diameter allows you to see the scabs, whereas over here, the 0.12 millimeter diameter, you don't see anything. You just see pinpoint bleeding. And each of these little crusties, turn all the way to the right a little bit. There you go. Each of these little areas are going to scab off over the next 5 to 7 days. And she's going to get hopefully 20-25% improvement in overall texture. And then we're going to start the process long term for her. Okay, great. A little more painful than the deep. So she'll feel it a little more in certain areas, but she's doing really well. Deep breathing. I'm going to go to the middle part now, which you'll feel a little less. Luckily, this is over very quickly because it is a little painful. Breathe. You're doing great. Even with the nerve blocks and pills and everything, people still feel, so we'll give her a little break. Good. But she's almost halfway done already.
Do you also use numbing cream on the face?
Yeah,
for
we
this?
did for about an hour, and we give 15 extra minutes too when we do the nerve blocks. But even still, it's still painful. Some people are much more sensitive. Some people, the nerve blocks don't last as long. You can go to sleep for these, but it's over very quick. And typically people don't, the reason it's hurting is we did multiple passes. There's much more heat in the skin. Okay, take a breather. Take a breather. I'm gonna finish another row. One more, hold on, I'll give you a break.
Almost there.
What'd you say?
Almost there.
Yes, so we're gonna finish this last row here, and then that side's done. So it's very quick, and the thing is, it doesn't hurt really after. It just feels like a sunburn the next couple days. And she has nerve blocks all here, but certain areas you feel a little more. So that side is done. Now I'm gonna have you turn all the way to the opposite side. And you guys can see, look, I mean, she has some areas of deep scar. So what we can do is we can actually make this, in some of these areas of even deeper scars, we can make it really small and go over a couple of these guys. Hold still, hon. I know it's hard. You're doing great. Fast. 2, 3, 3. Good. Turn all the way left in a second.
I have it. It's okay.
Give you a break.
Okay.
Concentrate, okay? You're almost done. You're 3/4. It's like running the marathon.
Yeah.
Did you see how we're getting some of these deeper scars? You could do TCA cross. But starting the lasers and then doing the halos and stuff long term will be really helpful for her. Okay, so now since we did all the little ones, we're going to now do the larger ones. Okay, turn all the way left. We'll start up at the top. Just breathe and concentrate, okay? This is only a few minutes, and then you're done. You can do it. We'll do the microneedling after. And she also feels just a little more because most people, when they do fractional, they do a very small percentage. Here we're doing almost 100%. She's very strong. So she's, look how well she's concentrating.
Yeah.
Just focus. It's literally 1.5 minutes. That's it.
What is the sensation feel?
It feels really hot. It's just very hot. It's like electrical heat. But look at, she's concentrated. She's doing great. We're gonna get her through it. I know. We're gonna move to a different area. Deep breath over there. So those are the sensitive spots. Some of these other areas, the nerves are there. Take a breather now. We're halfway done with that, okay? Take that breather. All right, you ready? Here we go. Good. And what we'll do is we'll put some topical gauze on her afterwards that cools everything down. Literally almost done with the cheek. Right there. Right there. She's doing so well. 2 more rows. You see how I do a little overlapping here because she's got a lot of those deeper ice picks. 1 more row. Beautiful. Okay, now we're going to finish up here. So we're going to finish up the active now, you guys. Around the mouth, she's got a lot of nerve blocks, so this should be much less. And then we're going to go to the microneedling and PRP, so we'll be right back. She's 90% complete.